I talked a little bit last week about Senator Wyden's report on the Medicare middlemen, the unraveling of the Medicare middleman, us. And one of the things that I didn't talk about last week, because it was just too much, is the fact that he did say that suppressing policies on an enrollment platform should not be allowed, that there's platform bias. So Connexure, Sunfire, that when they tell us there's no plan there because we couldn't get paid for it, then that should stop. He wants to make us fiduciaries so that we do what's in the best interest of our clients. So I'm extrapolating from that if the best interest of my client is to sell some little rinky-dink regional plan that has 5,000 members, that is not a good plan, but it covers one of their specialists, but all their other doctors are out of network, and I know this plan will have terrible, that I would tell them to go buy that plan. Even though I don't represent that plan, I would say, hey, here's the contact information, go buy that plan. I don't know how many businesses would say, hey, I need you to go to a competitor because it's going to be better for you. And I don't know how feasible that is to make us do that as well. Agents are not required to be contracted with all carriers. There's a lot of hurdles to be contracted to represent all carriers. It's not like the ACA. So there would be a lot of changes for us to be able to say, hey, we represent every carrier and go do that one. The platform bias is something else that I think is interesting. The other thing that I thought was very interesting that he talked about, we need to increase funding to this SHIP, the state health insurance programs, which are known by different names in different states. So it might be SHIBA or HICAP or whatever it is in your state. It is a federal office to help people with Medicare questions, and it's staffed primarily by volunteers. So the Journal of American Medicine, JAMA, you can Google this, put JAMA report on Medicare SHIPs from March, and it will tell you they were sadly disappointed. JAMA, the Journal of American Medicine, they generally are not fans of agents, right? And they said it was very hit and miss when they had secret shoppers call around the country, call different SHIP offices and ask them some basic questions. And 40% of the time, they couldn't answer the question. They gave a wrong answer. They gave an incomplete answer. That was 40% of the time. So that is what we've been telling you all along. That people say, well, I really don't want to use an agent because you are money motivated. And don't be afraid to bring that topic up. We get paid. There's no shame in getting paid. I work hard for my money. You got paid for your work. Nobody works for free. But SHIP is free. Yeah, but they're volunteers. They're volunteers. They haven't gone through the training, the annual certifications. They're not bonded, licensed, and insured, which insurance I pay for in case I make a mistake. So I have gone through extensive training and years of experience. I am a professional. You can have a good-hearted volunteer that retired and just didn't want to be bored, and they're going to go in there and try to help you by Googling stuff that you could have Googled yourself. They don't have the breadth of experience. They haven't worked with these insurance companies. Sure, they can say, you know what? I put your drugs in Medicare.gov and go enroll in this plan, and you can do that. You don't save any money. But then what happens when you have questions later? Are you going to go back to SHIP? I had so many people tell me this year that they could not get a hold of SHIP. Nobody would answer the phone, that they had to book appointments, that they missed appointments, they went and waited too long, and they couldn't see anybody because they don't have the bandwidth to help people. So be that as it may, I think it's a good idea that we do have volunteer offices available, but you need to explain to your clients what their value is. And that value is when you're first getting ready to retire and you don't know where to start, might be good to start there. Get some basic questions answered, get the lay of the land, but then you need to pick a professional, a licensed, bonded, certified professional to work with. We don't cost you any money. Our services are free. Pick somebody that can help you after the sale, can help you for the rest of your life, because somebody turning 65, they're expected to live another 16 and a half to 18 years, men versus women. And we want to be your agents for the rest of your life because all of this will change. So SHIP has a place, but you need to take it with a grain of salt because even an impartial Journal of American Medical Association, they're saying, hey, they don't do that great a job. We knew that all along. If you learned something today, please hit the subscribe or the follow button. See you next week.